You went up, huh? When did you go up? Where did you go? Yeah. Very sweet.
Okay, that's the name of that pig. Okay, big one. Oh!
That's where people go on Saturday, reach there and then come back again.
Alright, that team was going there, they're saying 6 days. Whole journey. 4 days going up.
Yeah.
Good, right?
Right.
But I worked in a blood bank in the western province of Zambia,
Right.
which is Lewanika General Hospital.
Right.
It's a provincial blood bank center. The setup and the system of our blood bank, blood transfusion services are that each province has a center where there's a nurse who is the donor recruiter.
Okay.
And the lab personnel do the screening.
Yeah.
And we have one lab medical scientist who is the manager of that center.
Okay.
And through the province, the blood transfusion services sends in some resources, money, and most of the equipment and all that is being donated, of course, from the EU. Came in so much.
Okay.
And so the donor recruiters do the donor recruitment in schools most of the time. Then the blood comes to the center and it's screened there. After screening, it's distributed in the different district hospitals that need the blood.
So screening would be what, serology or NAT testing?
Yes, we do the ELISA testing for HIV, hepatitis B and hepatitis C.
Syphilis, HIV, malaria. You just take history for malaria.
We just take history for malaria. Yeah, but if it's a big suspect, we do the malaria blood slides.
And then,
but most of it is the history, and we are all from malaria.
Exactly.
Packed cells, we do that in the provincial labs and the other blood transfusion centers, where blood is given. Like preparation of packed cells can be done, but platelets, it's done at the
center.
Yes, family donors. So those again, there are special cases that the National Blood Transfusion Services have maintained such families. But I know normally you can imagine at times maybe in our family there's someone who's the blood group O negative. They will definitely take care of such donors so that where there's need,
they can contact them.
Like each province has a blood bank center, blood transfusion center. So those provinces, they keep registers of their donors.
So quite well organized.
Yes, at the provincial level it's well organized. So each province looks after a number of districts. So they collect blood from all the districts and bring it one center, screen, and then send it back to the people that need it.
Usually, again, the provincial centers, they actually act as reserves to the national. Because in an event in Lusaka, there's a little bit of low supply. They will definitely contact the provincial centers so that they can actually.
It's 1,000.
It's a large hospital. Maternity, surgery,
pediatrics. It's got a complement of 5 hospitals, separate hospitals. The maternity hospital is a separate hospital. Biana and the maternity hospital. There's an eye hospital, Sekurukaguri Eye Hospital.
So what happens in an emergency? So if you have, say, a massive obstetric hemorrhage?
Now that is related with the prices of the blood. That if it's emergency situation, always the doctor that is there can communicate with the blood bank and they can release the blood components if it's necessary. But most of the time there is some things related with price of the blood component that may be delayed the transfusion to go to the side of the patient, and that is a challenge.
Who would have to pay for it?
The patient, they have to pay. Yes.
So do they have to pay for it at the laboratory, or is it at the admission to the hospital?
They have to pay to the...
Maybe I can come in there on the processes. When the patient comes in, they pay only for the admission. And if they are cash patient, paying patient, then they pay as stay.
Okay.
Yes. But there are laboratory tests that we demand cash upfront.
Okay.
And one of those is the blood supply.
Okay.
Because the hospital buys blood from the National Blood Service.
Okay.
Although at a subsidized cost.
Okay.
So our patients get their blood at a subsidized cost.
Okay.
Because we don't pass on, we just give them the cost.
Yes, there's
we
no
don't
profit.
Pass on, no profit.
Yeah.
We buy blood at half price from the National Blood Services.
Okay.
And then we supply to our patients.
Do you know
Now,
approximately how much would it be?
Yes, I know. Our blood costs $135 US.
Okay, that's
it's
red cells or whole blood? Or?
Whole blood.
Right.
Yes, a pack, one pack.
Okay.
Yeah, and it's the same price even for the AFFPs.
Okay.
Yes, same one pack price. But it's double if they have to buy it on their own.
Or in a private hospital.
Yeah, or in the private
Straight from the bank. If they have to go to the bank.
What about plasma? Do you use plasma?
Yeah, we use plasma. Yes.
FFP?
Yes, FFP. We have also cryoprecipitate that we don't advise to use in patient, like hemophilic patient, if we have concentrate.
Yeah.
But also there is challenges with this concentrate, and most of the time we have to use this type of blood component.
Okay.
But we have.
And how do you base?
Platelets also.
Yeah, you use.
We
Okay.
Well, we're just trying to teach our clinicians that they should use in a proper way the blood components.
Okay.
Yeah, and most of them, they know how to use it. That they have to transfuse red cells, and then also they have to complement with FFP when it's necessary.
Okay.
And I think that about that they are very well trained. When was a little crisis by the 2006 and 7, we couldn't use red blood cells. We were using white blood cells.
Because the political crisis.
Cost of the blood, but since
more
2009,
yeah.
2009 we have red blood cells.
Very good. And what about leukoreduction? Do you do leukoreduction?
Well, it's because the country, I don't think that we are doing.
No. Okay. The last question is about reactions, transfusion reactions.
Yes.
So if you have them, do they report it to the blood bank? Do you get?
Yes. There is a form that is in each ward.
Okay.
Where when they think that they have a transfusion reaction, they have to complete the form and go to the blood bank. I mean, I'm talking about Parin and Jata Hospital where I have more experience.
Okay.
Yeah, and then that is the process. Follow the process.
Is that?
Yeah, the policy across the country that the transfusion
overall,
have to be
reported. Okay.
Reported, investigated, and closed.
The service is well organized.
It is well organized, but there is no service that is perfect. It's really it has its shortfalls, and some of them economically related, but also some of them capacity.
Sure. So if somebody can't afford transfusion cost, what would happen then?
I shudder to say they can die.
You can't.
Like right now, as we are talking, we have the UNFPA, which is funding all our maternal.
Okay.
Yes. All our pregnant mothers are supposed to be free.
Okay.
There is a coupon system for procuring blood from the blood bank.
Okay.
But this runs out periodically sometimes.
Okay.
In the last 2 months, the source of our blood is primarily from school children.
Yes.
And in the last, the festive season, December, January, they were on
holidays,
leave, on holiday,
and
there was a critical shortage of blood.
Okay.
It only got better in the last 2 weeks when the schools reopened.
Okay.
So the blood bank can dry up because of that.
Okay. Do relatives donate blood in that case? Do family members?
Well, it's not a policy from the National Blood Bank.
No, but do you encourage when you're running critical shortage?
Yes, it is encouraged.
Yes, we encourage. But I mean, what is the policy of the National Blood Bank? That it's voluntary donor.
Not easy to get them to donate.
It's not easy.
Right.
You will get that from the natural donors.
Okay.
If one is in the family and they're already a natural donor.
Yeah. Okay.
But already the issue of blood donation is a cultural problem.
Yeah, sure. Okay.
And you may find that patients, they are over-transfused. Maybe they get a blood component that they shouldn't get, related with the pathology that they have.
Yeah.
And then about that we need to train and be educated.
Okay.
Yeah. But about the quality of the blood.
Okay. Fantastic. Thank you.
Okay.
So you are?
Richard Njoroge, Dr. Richard Njoroge.
Okay.
I work at Garissa Provincial General Hospital. I'm the pathologist there, and part of my duties include blood transfusion. You have to understand that blood transfusion in Kenya is done in the framework of the National Blood Transfusion Service.
Correct.
Which is a national service which has been charged with providing blood and blood products.
Right.
And has been existing in the last 10 years.
Right.
Now, initially, or over the last decade, we've been using whole blood. And it's only recently that we've tried to increase the use of components.
Okay.
Now, the National Blood Transfusion Service has published guidelines.
Okay.
And these guidelines, they're in the implementation phase.
Okay.
Where we are moving away from whole blood to components. Different centers have managed to achieve different successes.
At your hospital, how many bags of blood would you have, say, today, if you went to your hospital?
If blood group O, maybe 5 or 6.
Okay.
Blood group A, none.
Okay.
Blood group B, around 10.
Okay.
And blood group A, B, none.
Okay. So for about 250 bed hospital. So these are the number of blood units. Then that should be okay, you think, usually?
It's not okay. We usually have a lot of problems because Garissa is very, very far from Nairobi.
Yeah, okay.
Which is only able to do little donor recruitment and mobilization from among the community, which is a Muslim community, and and remoteness of the province, it's difficult to obtain adequate amount of blood.
Okay.
So when we have key emergencies, like because it's a security risk zone from terrorist activities, suicide bombings, shootings, they usually fly blood from Nairobi.
Oh, by helicopter?
By helicopter, by any other means. AMREF, Red Cross, they collect blood from the National Center or any of other regional centers which have adequate supply and then give. The curriculum, the curriculum for blood transfusion training in Kenya is deficient in that aspect because the teaching, I think, most of the health workers are not doctors, they are nurses, and what we call paramedics, clinical officers. So they are still being trained on use of whole blood.
Okay.
Whereas the doctors and the pathologists are moving, the curriculum is training on use of components and products. So there is a disconnect. And therefore, when I'm in Garissa, I get lots of, gets very disappointed. Even when we have the components, fresh frozen plasma, packed red cells, there is nobody to prescribe them unless they consult me and I prescribe them myself. Okay. So when I'm out of the station and we have a supply of packed cells, plasma, and other components, I'll still find them in the shop when I come back, despite patients being given blood. One of its mandate is to provide blood to everyone who needs it, whether public or private. Now, they provide blood to the public hospitals for free, without any charge. But if it's a private hospital, for which we have 2 or 3 in Garissa, they pay a cover charge to cover the cost of logistics. Every time a new group of interns
come, you were saying,
then the blood transfusion good practice plummets, and you have to go back to the beginning. Part of my job is to educate them on safe blood use. And I know we have a national program, and you have to understand the context in which Northeastern province is.
Sure.
It is the poorest, the most sparsely populated.
But when I come there, I'll experience that.
And the poorest part of Kenya.
Yeah.
Maternal mortality is over, under 5 mortality is above 1,000, which is the highest average in Kenya. Maternal mortality is 4 times the next best figure we get from Kenya. Now, the commonest cause of anemia in Garissa and Northeastern province, iron deficiency anemia, for which constitutes the major transfusion, the major reason for transfusion.
And the reason for iron deficiency is usually?
Nutritional.
Okay.
Nutritional.
It's because of poverty.
Yes. Okay. The next reason is postpartum hemorrhage. And these are patients who have been attended, obstructed labor. Labor which has been managed by traditional birth attendants. most deliveries in northeastern Kenya occur at home. And they only come to the hospital after everything else has failed at home. These are patients with obstructed labor, fistulas, and these are the ones who bleed. Eventually, after they deliver, they get the uterus has already
ruptured,
atony, and doesn't contract, and they bleed a lot. So that's the biggest issue we have in this country where I work. I know people are saying that we move to voluntary non-remunerated donations, but that blood is just not available. It's not enough.
So it's a donor problem.
That's a donor problem. So
but do you use replacement donations often?
Yes.
And they're happy, the families
constitute over 60%.
Oh, that's really interesting. Okay.
Yes.
That's family?
Let's say 50-50.
Okay.
If we be fair, 50% is voluntary donations. Yes, donated units we get from Nairobi. That's not enough. So we use replacement donations.
Okay, I'm Patrick Obo. I'm a principal laboratory technologist and therefore the head of laboratory department at Mwende Regional Referral Hospital.
How many beds does it have?
It's a 170 bed capacity hospital. Children who get anemic due to malaria.
Okay.
And they're also very common because malaria prevalence.
So anemia because of malaria, is that during acute malaria or chronic malaria?
Acute malaria.
So they need transfusion in the acute phase?
Yes.
And for children, do you use adult-sized blood bags or do you have smaller blood bags?
No, they're smaller blood bags. Usually they are quadruplex. The blood is put in different parts. One unit divided into 3 different parts. Of December, January, when children are out of school, there is a challenge because because of the prevalence of the HIV, the program decided that most of the blood should be taken from young children because most of them are not HIV positive. So when you find children are not there, now getting blood from the community is a challenge.
So do family people donate? Is that what happens then?
No, the family people in terms of replacement donation, no, that has been discouraged. So usually when children are not at school, they can go to a marketplace and select the possible donors. And then those recruitment.
Why is family donation not encouraged?
Family donation is not encouraged because in the recent times, maybe in the last 8-10 years, it was found that usually when you ask the family members to donate, sometimes you find that blood is not okay, especially the adult population.
Could be infected.
So the blood bank we used to do replacement donation where family members actually come donate for their family members. But then we were spending more resources on screening blood, which is not eventually useful.
Thank you, Patrick.
Yeah.
Thank you.